Have you ever wondered what really happens to your body when you reach climax every single day? It's a question that crosses countless minds, yet rarely gets discussed openly. And here's the thing that might surprise you. The answer isn't as straightforward as you'd expect. Could daily release actually be a sign of robust vitality? Or are we dealing with a case of too much of a good thing? Today, we're going to confront this topic head-on, examining what actually happens inside your body when you climax daily. We'll look at the surprising benefits that research has uncovered, explore the potential concerns you should be aware of, and give you the complete picture based on solid scientific evidence. By the end of this discussion, you'll have a much clearer understanding of how this common practice affects both your physical and mental well-being. So why can't we just give you a simple yes or no answer? Because the reality is far more complex and nuanced than that. Instead of oversimplified advice, we're going to walk through both sides of the equation. We'll examine what the latest research tells us about the advantages, and we'll also discuss the potential drawbacks that deserve your attention. Let's start with something that might genuinely surprise you. When we look at the scientific literature, there are actually several well-documented benefits to regular climax. These aren't just theories or wishful thinking, but findings backed by peer-reviewed research from respected institutions. The first remarkable benefit involves your brain's chemistry. Every time you reach peak arousal, your brain orchestrates an incredible release of feel-good chemicals. We're talking about a powerful cocktail that includes endorphins, which are your body's natural painkillers and mood elevators. You also get a significant surge of dopamine, a crucial neurotransmitter linked to pleasure, motivation, and reward processing. But that's not all. Your brain also releases oxytocin, often called the bonding hormone, because of its role in creating feelings of connection and deep relaxation. Finally, there's serotonin, which serves as a key mood regulator and contributes to your overall sense of well-being and contentment. Why is this hormonal cascade so beneficial? It's the reason you often feel relaxed, happy, and deeply satisfied afterward. This regular release of natural mood enhancers can contribute to better overall mental health, reduced baseline stress levels, and a powerful natural remedy against daily anxieties and tensions. The second benefit might explain why you feel drowsy after intimate moments. There's a notable improvement in sleep quality that many men experience. If you've ever felt sleepy shortly after climax, you're experiencing a very common physiological response that's actually quite beneficial. This drowsiness is largely due to the release of a specific hormone called prolactin. This chemical messenger is known to induce feelings of deep relaxation and sleepiness. Countless men report that they find it much easier to fall asleep after intimate moments, but prolactin isn't working alone. Those same pleasure hormones we just discussed, including oxytocin and endorphins, work together to significantly reduce your stress levels and promote a state of profound calm. This makes it much easier for both your body and mind to transition into restful sleep. For someone struggling with insomnia, restless nights, or difficulty unwinding, this natural sedative effect can be tremendously beneficial. It potentially leads to better sleep quality and, as a direct result, more sustained energy and mental clarity throughout the following day. The third benefit involves your cardiovascular system in ways you might not expect. Regular climax promotes something called vasodilation, which is the biological term for the widening of your blood vessels. During arousal and peak moments, your heart rate naturally increases and blood flow improves throughout your entire body, not just to your reproductive organs. This process helps your blood vessels expand and become more flexible, which is profoundly beneficial for your entire cardiovascular system. Better blood circulation ensures that oxygen and essential nutrients are delivered more efficiently to all your organs and tissues. Over time, this can contribute to better heart health and may even help reduce blood pressure. Think of it not as strenuous exercise, but as gentle, consistent conditioning for your circulatory system. It's like giving your cardiovascular network a regular, pleasant workout that keeps everything flowing smoothly. Now here's where things get really interesting from a health perspective. One of the most discussed benefits of regular release involves prostate health. Several major studies have meticulously investigated this relationship, and the findings are quite compelling. The most notable research was a long-term study conducted by Harvard University that followed more than 30,000 men for nearly 2 decades. The results, published in the prestigious journal European Urology, revealed a fascinating finding. Men who experienced frequent release, specifically 21 or more times per month, had a significantly lower risk of developing prostate cancer compared to those who experienced release less frequently. The prevailing scientific theory behind this protective effect is that frequent release helps cleanse the prostate gland, flushing out potentially harmful substances and old cells that might otherwise accumulate and eventually become problematic. While it's not a definitive guarantee or prevention method in all cases, this research offers compelling evidence that regular activity may play a powerful protective role for prostate health. The fifth benefit might be the most unexpected of all. There's emerging evidence suggesting that regular intimate activity could actually boost your immune system. You might not instinctively connect physical pleasure with fighting off a cold, but some research suggests there may be a genuine link. Studies have shown that arousal and climax can lead to increased levels of certain antibodies, particularly immunoglobulin A or IgA. This antibody is recognized as one of your body's first lines of defense against invading viruses and bacteria. But that's not the only immune connection. The stress-reducing effects we discussed earlier also play a crucial role here. Chronic stress is well known for suppressing immune function, making you more susceptible to illness. By helping to reduce your baseline stress levels, regular release may indirectly support a stronger, more responsive immune system, which in turn can help you stay healthier overall. Now, before you start thinking this is all sunshine and rainbows, we need to address the other side of this equation. Like most things in life, there can be too much of a good thing, and daily habits can sometimes develop complications that deserve serious consideration. The reality is that, while there are documented benefits, there are also potential concerns that responsible health information must acknowledge. These aren't meant to scare you, but rather to give you the complete picture so you can make informed decisions about your own health and habits. In the next part of our discussion, we'll examine these potential drawbacks in detail, explore when daily habits might become problematic, and discuss the specific circumstances where moderation might be more beneficial than frequency. We'll also look at how individual factors like age, relationship status, and overall health can influence what's optimal for each person. The first potential concern we need to discuss, honestly, is psychological dependency. There's a crucial distinction between enjoying something as part of a healthy routine and developing what becomes a compulsive behavior pattern. This is where things can shift from beneficial to problematic. How can you tell the difference? If you genuinely enjoy daily release, and it doesn't negatively impact any aspect of your life, then it's likely not an issue for you. However, warning signs emerge when you begin feeling an overwhelming, uncontrollable urge that starts interfering with work, social interactions, or daily responsibilities. What characterizes compulsive behavior? It's defined by a complete loss of control, where the activity is no longer a conscious choice, but feels like an unavoidable necessity. This can lead to profound feelings of guilt or shame, and may indicate underlying psychological issues that need professional attention. The key question to ask yourself is simple. Am I in control of this habit, or is it controlling me? If you find yourself arranging your schedule around it, missing important commitments, or feeling anxious when you can't engage in it, these could be red flags worth examining. The second concern relates specifically to reproductive health and fertility. When you climax daily, there's a measurable impact on sperm concentration in your semen. Your body requires approximately 72 hours to produce and mature sperm to optimal levels. Daily release doesn't allow sufficient time for complete replenishment, resulting in lower overall sperm count per instance. For most men, this wouldn't be a cause for concern. However, if you and your partner are actively trying to conceive, daily habits might reduce your overall chances of success. The solution in this scenario is straightforward. Spacing releases to every 2 or 3 days can help ensure maximum sperm concentration, potentially increasing fertilization probability. It's not about stopping entirely, but rather about timing for optimal reproductive outcomes. The third potential issue involves sexual performance and conditioning. This is particularly relevant if daily habits occur through rapid self-stimulation. When you consistently rush toward climax as quickly as possible, you're essentially training your body and mind for speed rather than endurance. This conditioning can be challenging to reverse and often translates into premature release during partnered intimacy. But the problems don't stop there. This pattern can create a destructive cycle of performance anxiety. Worrying about lasting longer can contribute to psychological difficulties with maintaining arousal or achieving satisfaction. The fear of underperforming becomes a self-fulfilling prophecy, where mental stress interferes with natural physical responses. What makes this particularly frustrating is how these concerns can compound each other. Performance anxiety leads to more rapid solo sessions for relief, which further reinforces the quick release conditioning, creating an increasingly difficult cycle to break. There's also a physical consideration regarding sensitivity and response. Daily stimulation, especially if done with excessive pressure or speed, can potentially lead to reduced sensitivity over time. Your body may require increasingly intense stimulation to achieve the same level of satisfaction. This isn't permanent damage, but it can affect your ability to respond to gentler, more varied types of stimulation. It's similar to how your taste buds might become less sensitive to subtle flavors if you consistently eat very spicy or intensely flavored foods. Another factor worth considering is energy and motivation levels. While the immediate post-climax period often brings relaxation and contentment, some men report feeling less driven or motivated when engaging in daily release. This isn't universal, but it's worth monitoring in yourself. The theory behind this relates to dopamine regulation and reward systems in your brain. Some researchers suggest that frequent artificial dopamine spikes might affect your natural motivation for other activities, though the evidence on this remains mixed and highly individual. Relationship dynamics present another area of potential concern. If you're in a committed relationship, daily solo activities might impact your desire for partnered intimacy. This can create tension or feelings of rejection in your partner, even if that's not your intention. Communication becomes crucial here. Some couples find that daily habits enhance their intimate connection, while others experience it as competitive or replacement behavior. The key is honest discussion about needs, expectations, and boundaries. There's also the matter of time and priority management. If daily habits are consuming significant portions of your day or causing you to neglect other important activities, this suggests an imbalance that might need addressing. Physical irritation or discomfort can also develop with very frequent activity, particularly if proper lubrication isn't used or if technique is too aggressive. While minor, these issues can compound over time and affect overall comfort and enjoyment. Age plays a significant role in how your body responds to daily habits. Younger men typically recover more quickly and may experience fewer negative effects, while older men might notice more pronounced impacts on energy levels or require longer recovery periods between sessions. Individual health status matters enormously. Men with certain medical conditions, those taking specific medications, or those with hormonal imbalances might experience different effects than the general population. This is why personalized medical advice is always preferable to general guidelines. The timing of daily activities can also influence their impact. Some men find morning sessions energizing, while others prefer evening release for better sleep. Some discover that midday activities leave them feeling drained for the rest of the day. Mental health status significantly affects how daily habits impact your overall well-being. If you're dealing with depression, anxiety, or high stress levels, the effects might be quite different than during periods of good mental health. Now, having explored both the benefits and potential concerns, you might be wondering what constitutes the optimal approach for your individual situation. The truth is, there's no universal answer that applies to everyone. Your age, relationship status, overall health, stress levels, goals, and personal preferences all factor into what might work best for you. What's optimal for a single 25-year-old might be completely different from what works for a married 40-year-old or a divorced 50-year-old. This is where self-awareness becomes your most valuable tool. Pay attention to how daily habits affect your energy, mood, relationships, motivation, and overall life satisfaction. These personal observations are more valuable than any general recommendation. If you notice positive effects on your sleep quality, stress management, and overall well-being, then daily habits might be serving you well. However, if you're experiencing fatigue, relationship tensions, or feeling like the behavior is controlling you rather than the other way around, it might be time to reassess your approach. Consider keeping a simple journal for a week or two. Note your energy levels, mood, relationship satisfaction, and productivity. This data will give you valuable insights into how your current habits are actually affecting your life, rather than how you think they should be affecting it. The quality versus quantity debate is particularly relevant here. Instead of focusing solely on frequency, consider the quality of your experiences. Are you rushing through the process, or are you taking time to truly enjoy and appreciate the sensations? Are you present in the moment, or are you going through the motions out of habit? Many men find that reducing frequency while improving quality leads to more satisfying experiences overall. This might mean engaging every other day or a few times per week, but with greater mindfulness and attention to the process. Your relationship status significantly influences what might be optimal. Single men have different considerations than those in committed relationships. If you're partnered, honest communication about needs and expectations becomes essential. Some couples find that individual habits enhance their shared intimacy, while others prefer to focus energy primarily on partnered activities. Stress levels and life circumstances also play crucial roles. During high stress periods, some men find daily release helpful for tension management. Others discover that it drains energy they need for dealing with challenging situations. Pay attention to these patterns in your own life. Physical health considerations matter more as we age. If you're dealing with any medical conditions, taking medications, or experiencing changes in energy or libido, these factors should influence your approach. Don't hesitate to discuss these topics with your healthcare provider if you have concerns. The seasonal and cyclical nature of male hormones means your optimal frequency might naturally vary throughout the year or even throughout the month. Rather than forcing consistency, consider allowing for this natural variation. Goal setting can provide useful structure. If you're trying to conceive, preparing for athletic performance, or working on specific relationship dynamics, these goals should inform your approach to frequency and timing. Mindfulness and present moment awareness can transform any frequency into a more beneficial experience. Whether you engage daily or less frequently, bringing full attention to the process enhances both physical and mental benefits, while reducing the risk of it becoming mechanical or compulsive. Technique and approach matter tremendously. Gentle, varied stimulation tends to be more beneficial long-term than aggressive or rushed techniques. Taking time for relaxation afterward allows you to fully experience the stress relief and mood benefits we discussed earlier. Environmental factors shouldn't be overlooked. Privacy comfort, and freedom from time pressure all contribute to more positive experiences and reduce the likelihood of developing performance anxiety or rushed habits. If you discover that daily habits aren't serving you well, reduction strategies can be helpful. This might involve gradually extending time between sessions, finding alternative stress relief methods, or redirecting energy toward other fulfilling activities. For men who want to maintain some regularity while addressing concerns, alternating days often provides a good balance. This approach allows for consistent stress relief and health benefits while giving your body time for optimal recovery. The role of professional guidance shouldn't be underestimated. If you're experiencing performance issues, relationship difficulties, or feeling that habits have become compulsive, speaking with a healthcare provider or counselor can provide personalized strategies and peace of mind. Remember that optimal approaches can evolve over time. What works in your 20s might need adjustment in your 40s. Life changes, stress levels, relationships, and health status all influence what serves you best at any given time. The key takeaway from all this research and consideration is that there's no single right answer for everyone. Daily Climax can offer genuine health benefits for many men, including improved mood, better sleep, enhanced circulation, potential prostate protection, and immune system support. However, these benefits come with important caveats. Frequency should never feel compulsive or interfere with other life priorities. If you're trying to conceive, daily habits might not be optimal. And if you're experiencing performance issues or relationship tensions, moderation might be more beneficial. Your body and mind are constantly giving you feedback about what's working and what isn't. Learning to listen to these signals and adjust accordingly is far more valuable than following any rigid formula or schedule. The goal isn't to find the perfect frequency and stick to it forever. The goal is to develop a healthy, sustainable approach that enhances your overall well-being and fits naturally into your life without causing stress or complications. Whether that means daily, every other day, a few times per week, or some other pattern entirely depends on your unique circumstances, goals, and responses. Trust your own experience. Stay aware of how your habits affect all areas of your life, and don't hesitate to make adjustments as needed. Most importantly, remember that sexual health is just one component of overall wellness. A balanced approach that includes good nutrition, regular exercise, adequate sleep, stress management, and meaningful relationships will always serve you better than focusing on any single aspect in isolation. If this information has been helpful in understanding your own patterns and options, please consider sharing it with others who might benefit. Sexual health remains a topic many men struggle with in silence, and open, evidence-based discussions can help break down unnecessary shame and confusion. Hit that like button if you found this analysis valuable, and make sure you're subscribed for more honest, science-based health content. Drop a comment below sharing your thoughts or any questions you still have. And remember that your health journey is uniquely yours to navigate with wisdom and self-awareness.